Welcome to the Lenica Health Podcast, where we dive deep into the world of mental health and explore how technology can help us improve our mental well-being. Lenica is a digital mental health platform that combines data from wearable devices, neurofeedback technologies, and virtual reality experiences to support better mental health outcomes. Join us as we speak with experts in the field and hear stories from real people who have found solace and support through digital mental health resources. We believe that mental health is just as important as physical health, and we are committed to breaking down stigma surrounding mental health and advocating for accessible and effective mental health care. So sit back, relax, and let's start the conversation about mental health in the digital age. In today's episode, we're excited to be joined by Dr. Virginia Newton, a clinical neuropsychologist with deep expertise working with a diverse population of patients with various medical and psychological conditions. Located in Calgary, Alberta, Dr. Newton will be sharing her insight on current trends in mental health, the potential use of biometric to support patient outcomes, and how to improve potentially therapy adherence. Welcome, Dr. Newton.
Thank you, Simba. Thank you so much for inviting me to your podcast.
Nice to have you here. So tell us about your clinic and the population you typically work with.
So I have an independent clinical practice here in Calgary, as you mentioned, and I provide clinical neuropsychological assessments and counseling to people with neuropsychiatric disorders. And those are conditions that border neurology and psychiatry. So things like post-concussive disorder, functional neurological disorder, psychogenic non-epileptic seizures, psychosis, bipolar disorder, those types of conditions.
And so it sounds like you see a whole range of patients in your clinic, and you kind of work at the intersection of different potential mental conditions. What sort of trends are you currently seeing at this point in the mental health field with the population that you work with?
I think across the mental health sphere on the whole, there's an increasing interest in neuroplasticity as part of mental health. So interventions that involve neuromodulation, like transcranial magnetic stimulation, are becoming quite popular or gaining some traction, as well as things at the other end of the spectrum, like psychedelic assisted therapy, which some people perceive as a way to reset the brain. There's also a focus on optimizing brain wellness through lifestyle choices. And some of these optimization techniques involve computer technologies such as virtual reality or augmented reality, as well as biometric measurement.
Fascinating, and I think like everyone is excited about how technology can be utilized maybe to accelerate a lot of these mental wellness and mental health outcomes for our population. And so with these trends, what is kind of at the heart of influencing how these trends are changing? Is it better adoption to technology? Is it a more comfort with how people are accessing some of this technology? What do you kind of see as some of those influencing factors?
I think that there's a combination of people becoming much more comfortable with the use of technology and also with things like psychedelics. There's a huge surge of public opinion around that right now. And also the technology is becoming much more user-friendly. So we now have these wearable devices. Even in the virtual reality world, it's very easy to buy goggles now for that type of intervention. So it makes it much easier to use in clinical settings and much more cost-effective.
And with these technologies, are there like some key specific technology you're excited about?
I'm always pretty skeptical about the technologies because many of the manufacturers make all kinds of claims that then don't really pan out in sort of third-party research studies. But I have been trying out a number of biofeedback and neurofeedback devices with my clients in counseling sessions and really relying on them to tell me which technologies are most effective for them in terms of encouraging or improving positive behavioral and cognitive changes.
And for those people listening that might not know what biofeedback or neurofeedback is there like a grade 12 definition to help people be able to become familiar with what that is?
I'll do my best. So, biofeedback is a way of monitoring different parts of the system, typically bodily responses that come from the nervous system, like heart rate, skin temperature, that type of thing, as well as brain waves. So, neurofeedback is a subsection of biofeedback, and it relies on brainwave monitoring. And then the feedback part is involves engaging in an activity where the biofeedback or neurofeedback program gives direct feedback to the person using it, either in the form of an auditory cue or a visual cue.
And it sounds amazing because if, let's say, people might not be aware of what's going on internally or whether they are focused or whether they are stressed, it sounds like there's a lot of opportunity to increase patients' awareness with these forms of technology.
Absolutely. I think that that's actually one of the biggest benefits of using this technology in mental health treatment. Sometimes people are very good at rationalizing their difficult situations and not recognizing or even ignoring internal cues about stress. And when we talk about stress, we're really talking about system stress, nervous system stress, psychological stress, cognitive stress, physiological stress. So we're very good at just sort of shoving all that aside, pushing through situations which then only make us feel worse. So the use of these technologies can sort of keep highlighting to our clients what's going on with the system, when they need to recognize their warning signs, back down, take a rest, change things up, or even take some more assertive action, like setting psychological boundaries or leaving certain situations. So it can be very, very helpful in that regard. And on the flip side, I think there are some individuals who also kind of set up a situation to be stressful when in fact they've got perfectly adequate coping mechanisms and they can manage those situations without any real change in their system level of anxiety. So that can be very reassuring and sort of empowering for those clients as well.
Fascinating. And do you see these technologies being used particularly in a clinical setting, or is the hope that they can be used both in a clinical setting and when the patient is just going through their day-to-day activities?
hmm I think a combination of both is ideal. So we can train people kind of the meaningfulness of the biometric markers within a counseling session. And I have been actually using some neurofeedback headbands just to point out to patients when their brains are overly active and the other signs of stress that are associated with that. So if a client is sitting in my office and their brainwave activity is very high, very active, showing that their system is under stress, and then they're breathing irregularly, they're holding their breath, and I can make the connection between those two things for the client, and then they can monitor that at home. So some of the feedback devices I use have a tracking or a wellness tracker included with them. So patients can go about their daily activities, doing their work, engaging in leisure activities, or even difficult conversations, and watch how their brain responds or their other system marker responds to that. Heart rate variability being one of the kind of easiest ones to keep track in that way.
Absolutely. And I can imagine even people and patients being able to maybe see their progress as they move forward could be something that's very empowering. Because when I'm in a stressful situation, being able to know that my stress is going down, even though it might not feel like it's going down, I can see that being very encouraging. From your experience, have you seen patients that have become more stressed out with the use of this technology? In terms of maybe being worried that, oh, they're not making as fast of progress, or because they want to see their heart rate variability, for example, go down?
I haven't really seen that. I think initially what tends to happen are clients are concerned that they have sort of been ignoring these warning signs, or they weren't recognizing their warning signs, or they learned that they actually don't know how to calm their system down when they thought they did. I think those are more, it's sort of this light bulb moment for people. But I don't see it as sort of the person trying to beat the device, as it were, and getting frustrated that they're not, because I think that's the downside of just relying on the technology. If you have a clinician guiding the person, then that clinician can help the person realize that they need to manage the situations. They need to engage in some behavioral strategies that is then going to influence the technology. You can't just think the technology into sort of, it's not like a game where you think the technology into winning the game. You have to change your system behavior in order to make those gains.
Absolutely, and I think you bring up an amazing point because a lot of technology companies like ourselves are very excited about the use of AI as an example to be able to support some of these mental wellness outcomes for a large population. But we also believe that it is very important that that clinical lens be there and be able to take into account the contextual factors that might change from one patient to the other that that technology might not be able to actually take into account. So from the sounds of it, you truly believe that the technology is there, but it really needs that support of a clinician to ensure that we have got adequate and really good clinical outcomes.
Oh, absolutely. Right. This is all about personalizing the interventions to the clients. Otherwise, you're just playing a game. Otherwise, just go on to the internet and find some brain training games to play, and you can pretty much have the same outcome. You really need to have those insight moments that come with working a clinician who can guide you through the technology and what it's showing, in terms of what's going on with the system, the person's internal system.
Absolutely. And shifting gears a little bit, one of the things that, in terms of looking at patient outcomes, because that's kind of what we are hoping to improve, is that adherence to treatment seems to be a primary hindrance to people actually achieving the outcomes that they want, especially if, let's say, patients come in to see a psychologist or to see you, a neuropsychologist, once every single week. And so do you see the use of technology, one, improving adherence, and how might it maybe influence how people actually adhere to their clinical homework, for lack of a better word?
I think there's a couple of components to this. And one is people really like to see data. They like to see data that indicates either they're making progress or they're experiencing some challenges. So I think that that's super helpful. And also going to a lot of these technologies require frequent use to have the most benefit, most positive benefit. So coming to see a psychologist or a neuropsychologist once a week or twice a month may not be that effective, and it can be expensive as well. So the devices can really offer a way for the person to practice their homework, to monitor their own system in terms of stress levels, and to become more independent from the clinician in terms of making progress.
Fascinating, yeah, and it's exciting to hear that there might be a ways to be able to support that adherence and for the patient to feel and kind of get a sense that they've got that data. And
Mhm.
so, do you see the use of this form of technology being common with your peers, or is this still a pretty new and hesitant area in which some psychologists might know that the benefits is there, but they're kind of still wondering if it's valid enough to actually incorporate into their practice?
Yeah, I think there's a variety of perspectives on this. There are some people who incorporate one or two um, technologies or devices in their practice, like neurofeedback. But I think there are people who don't understand the technology, and particularly the latest advances in the technology, for sure. So, we have way more than neurofeedback systems, which in the old style can be a little bit clumsy to work with. There are lots of these wearable devices that are becoming really quite slick and offering a lot of real-time data. And I think we also have some clinicians who goes to sort of the opposite extreme, and all they do is provide these devices and either in the clinic or send people off with them. And again, I think that's missing the human connection piece and the insights that the psychologist or the clinician can provide to the patient. We can't rely so much on the clients to sort of pull all this together. They don't have the knowledge in some cases or the experience or the understanding to understand or to apply what the technology is providing at a deeper level in terms of their mental health.
And how about from the patient perspective? What has been your experience in them kind of being introduced to this new technology?
Actually, people tend to really love it. Some people are not interested, but most of my clients really like playing around with the devices I have and picking one that they really resonate with. And most of them aim for a purchase of a device themselves so they can continue using it at home. Some people get a couple of them, use them at the same time, alternate them. Um, they just tend to be helpful across the board if you have someone who is willing to use it consistently.
That's good to hear. And I think, again, the more people get more comfortable with technology, the more the patients are likely to also want to kind of explore how technology can be used to actually benefit some of those outcomes.
Yeah. I think the proof is in what the clients experience in terms of changes, their emotional changes, behavioral changes, changes in physical problems or discomfort. That's really the tell as to whether these devices are working.
And I guess in terms of, as we start to conclude today's session, are there any, like for those people that might be hesitant, I guess, to utilize technology, whether it's a clinician or a client, do you have anything that you can share with them that you might kind of, based on your experience, that maybe there are benefits or maybe drawbacks to using technology, depending on where they're at?
So from the clinician perspective or the patient perspective?
We can start from the clinician perspective.
From the clinician perspective, I think one of the main benefits for clinicians would be able to get some of that data within the session. As I was saying, if you can track people's heart rate variability, their brainwave activity, some of these other markers within a counseling session can really provide you a lot of information as to what's going on with that patient that they might not recognize themselves or they might not be willing to talk. So you gives you the opportunity to do some gentle exploration of that within the session and sort of improve insight by on your side and also the patient's side. I think the drawbacks again, the main concern I have is really relying too much on the technology. It's meant to be used as a tool to augment psychological therapy. The talk therapies like cognitive behavioral therapy, mindfulness-based therapy still have a lot to offer and are really the foundation for us, but sometimes that's not enough. And it's useful to have something that is a bit more driven by research that can help us do our work.
That's exciting. As you know, from our perspective, we get excited about technology, but it's not lost to us that it needs to be well developed, used in context, and meet the needs of both the patient and the clinician. Perfect. Well, thank you, Dr. Newton. We really appreciate your expertise and your insights into not only the work that you do, but how you have used and your perspective on utilizing technologies with our patients in the mental health field. To our listeners, if you are interested in learning more about Dr. Newton or visiting her practice, you can visit www.newtonneuropsych.com. For those of you that are interested in using biometric in your own clinical practice, you can schedule a demo to test out the Lenica platform by visiting www.lenicaresearchgroup.com. Thank you again, Dr. Newton. And if you want to learn more, feel free to visit our other episodes where we continue to talk about the different technologies and how mental health is changing in the digital age.
Thank you, Simba.